Kó tó di pé a mọ̀ lọ ní orí ètò ẹ rí i pé mi àmọ̀ sọ̀kan pé ìpínlẹ̀ Kwara la wà lóye lóòótọ́ àmọ́ gbogbo àgbáyé náà ń gbọ́ wa tí wọ́n sì láǹfààní àti máa wò wá àmọ́ kì í ṣe pé gbogbo wa la gbọ́ èdè Yorùbá yóò wù mí náà láàrin ìṣẹ́jú 2 sí 3 at least kẹ́tì ẹ̀ bá wa rí sí pẹ̀lú àwọn tí wọ́n jẹ́ listeners wa ní èdè òyìnbó you can even come down to their own level.
Then, so the main discourse of today is centered on addressing some contemporary issues within the natural medicine practice and the conventional medicine treatments approach. So there are some fertility health concerns that in conventional medicine, there is the only solution or the best approach to address them is surgical procedures. So such as varicocele, which is dilation of the vein within the testicular environment, which is a major factor that impairs testicular functions and affects the quality of sperm health. So these varicocele and other similar conditions like hydrocele and microlithiasis and the likes, they are often addressed using surgical procedure. But addressing this with surgery is like 50-50 chance. So there's chance of achieving success and there's chance of getting the condition more complicated. There's some irreversible complications that can surface as a result of varicocelectomy, that's the surgical removal of the varicocele. So I often advise patients, if you have these conditions, there are invasive ways to address it, which is the surgery, and there are non-invasive ways to address it, which is through natural medicine modalities. We've been able to address this condition, for a lot of patients, and we've achieved massive success. I can boldly say we have like 70 to 80% success, rate on addressing varicocele. So instead of going for the invasive procedure first, I think what is ideal is to address health conditions with the least invasive approach. That is, in fact, what I call it a theory in medicine. The best treatment approach is the least invasive approach. So the best treatment modality is the one that does not have to do with tearing of the body, cutting of the body, sewing of the body parts. If there is any solution that can prevent surgical procedure from happening, and it's sure that the solution will give us the desired result, then it is best to go for that solution. So I have a patient that was having varicocele and it has affected his testicular function, and he was told by his wife's doctor that there can't be any solution. So this makes the relationship to, this and other reasons make the relationship to split. So I was telling him that the doctor shouldn't have said that. This is number one, is that even in conventional medicine, the surgery is not 100% failure. It can be successful, it can be unsuccessful.
That's 50-50.
50-50. So telling him outrightly that it to be a failure is like you're not giving him any hope.
Yeah, it discourages you.
It's a total discouragement. At least if that is your own solution, I mean, if the surgery is your own solution, you still make him to be quite optimistic. Tell him about patient that you've treated. It's not lying. It's about giving them that positive vibe. So he said it outrightly that there can't be any solution, and that was how the relationship broke. So I said, then secondly, I want to believe that he knows that there are some other treatments approach to address varicocele that brings results.
Okay.
He should have recommended for them. He should have told them to go for other treatments approach. But because of this issue that conventional medicine practitioners have with natural medicine, professionals, they when they say that you're a natural medicine practitioner, then you are I don't even know how to describe it. So it shouldn't be like that, because once this person is getting results to a patient that is having issue, what they need is solution. They don't care if you are using conventional medicine or you're using natural medicine. What concerns them is that the problem that they find themselves in, how do they get out of it? How do they get solution out of it? So the issue of rivalry or the issue of, this one is natural, I beg, don't mind them, that they don't care about it. So as an healthcare provider, our goal and our desire is to ensure that our patient gets well, irrespective of the treatment approach, treatment modality that they use. In as much the person treating them is a professional that understands what he's doing, that understands the science and the knowledge that backs his treatments, that backs his profession. So not just outrightly tell the patient that there's no solution, there's nothing, because you cannot address it. So if you can't address the condition, tell them to go elsewhere. Tell them to approach and apply other treatment modalities, because there are different ways that enters the market. There's no just one way, right?
Yes.
There are a lot of conditions that cannot be addressed with natural medicine that will be needing invasive procedures. And there are a lot of conditions that cannot be addressed with invasive procedures that can be addressed with natural medicine. So it's until when we understand this and understand the fact that the goal is not to showcase, our knowledge or showcase our grammars or showcase the goal is to ensure that the patients get solution to their conditions. So when we understand that, and we put this as a priority, then it makes it, more, it increases the chance of the patients getting the solution to their condition, and it also increases our value before our patients.
Thank you, sir. Torí ibi tí ẹ gbé lọ́hùn ọ̀nà ti pọ̀, àsìkò wa wá ní ó ti kó wa ní pápámọ́ra, mo dùn mọ́ mi pọ̀ tí mo fẹ́ ká ṣe nǹkan kan tọ́ra àwọn èèyàn tí mẹ́sẹ̀gì mi náà pẹ̀lú ọ̀rọ̀ fóònù nọ́mbà yìí. Ohun tèmi wá fẹ́ kí a ṣe ń bẹ̀rẹ̀ ẹ jẹ́ n pe nọ́mbà yẹn fún àwọn tí wọ́n ń pè wá. Ẹ dákun torí Ọlọ́run, nọ́mbà tẹ́ ẹ bá ń gbọ́ òun náà ni ẹ máa pè, kì í ṣe nọ́mbà ti tèmi. Èmi á máa sọ ní gbogbo gbà 091 69 46 77 89 091 69 46 77 89 nọ́mbà tó wọlé ṣẹ́ wọn náà, tàbí 070 26 23 34 41 070 26 23 34 41 nọ́mbà tó wọlé ṣe Criterion Holistic Wellness Home gangan nìyẹn. Ẹ bá ti pè wọ́n lọ́gán àwọn náà wọ́n gbé. Kó tó dìgbà míì tátùmọ̀ láyọ̀ láǹfààní àti máa pàdé o lórí ètò yìí. Ẹ ṣeun ẹ ń gbọ́ wa, a máa pàdé láyọ̀ àti àlàáfíà. Ẹ ṣé o. My country people, ìdán ìṣẹ̀lẹ̀.